Welcome to the deep dive. Today we're jumping into something really fundamental in breast health. A big shift away from, what many people were taught for years, the breast self-examination, or BSE.
That's right. It's a significant change, driven entirely by evidence.
So our mission today is pretty straightforward. We want to unpack why that old method, BSE, was essentially retired by major health bodies.
And crucially, define what the new standard is. Breast self-awareness, BSA. What does that actually mean for you?
Exactly. So you know what your role is in early detection now.
Okay, so the core reason for moving away from BSE, it really boils down to the data from large, rigorous studies.
It's like those big clinical trials, right?
Yeah.
The ones in Shanghai and St. Petersburg.
Precisely. These were prospective randomized controlled trials, the gold standard. And they found that systematically teaching women a monthly BSE ritual, it just didn't move the needle.
Didn't move the needle in terms of saving lives.
Correct. No reduction in breast cancer mortality rates.
Yeah.
And it didn't even consistently lead to detecting cancers at an earlier stage compared to women who weren't taught the technique. If the main goal is saving lives or catching it earlier, BSE failed on both counts.
Wow. Okay, but here's where it gets, I think, really compelling or maybe disturbing. It wasn't just that it didn't work. The study showed it caused actual harm.
Yes, significant documented harm. This is critical.
The groups taught routine BSE. They had twice the number of biopsies that came back benign negative compared to the control group.
Twice as many. Think about that. Double the invasive procedures, double the anxiety, the waiting for results.
The cost to the healthcare system, the psychological toll, all for what turned out to be false alarms. That's staggering.
It is. And when you weigh that lack of proven benefit against these very real documented harms, the conclusion becomes unavoidable.
So health organizations looked at this and said, wait a minute.
Exactly. The evidence just wasn't there to support teaching it, and the harms were clear. So resources needed to shift. Bodies like the U.S. Preventive Services Task Force now actively recommend against teaching routine BSE.
Okay, so if the ritualistic BSE is out, what's the recommended approach now? Let's get into breast self-awareness, BSA. How is it different?
It's a fundamental shift in mindset, really. BSA moves away from that rigid, scheduled, often stressful monthly exam.
Less ritual, more general vigilance.
Perfectly put. It's about continuous personal awareness. Knowing the normal look and feel of your own breasts. Familiarity is key.
So you can spot changes from your baseline, something different, something persistent.
Right. And this actually helps explain a seeming contradiction. We know BSE as a taught method failed in trials
Yet something like 40% of cancers are still found by women themselves, right?
Exactly. But how are they finding them? Usually it's incidentally.
Meaning, like, by chance. While showering, getting dressed, maybe lotioning, not during a formal exam.
Correct. It's not typically during that structured, systematic check that BSE promoted. This pattern of incidental discovery actually supports the BSA philosophy. General awareness and noticing changes leads to detection, not necessarily a forced monthly ritual.
Okay, that makes sense. So how does BSA fit into the bigger picture of breast screening? Where does it sit alongside mammograms and doctor visits?
That's crucial. BSA is an adjunct tool. It's important, but it absolutely does not replace professional screening methods.
It's a supplement, not a substitute.
Precisely. Mammography is still the gold standard. Annual mammograms are recommended for women 40 and over.
And clinical breast exams, the ones done by a doctor or nurse.
Also vital. Recommended every 1 to 3 years for women in their 20s and 30s, and then annually from 40 onwards, usually alongside the mammogram.
So BSA is kind of the ongoing monitoring system between those professional checks.
That's a great way to think about it. It's your personal safety net, your alert system that functions 365 days a year, bridging the gaps between those scheduled appointments.
So for you, the listener, the key action with BSA is noticing and reporting. Any change that's new or persistent needs to be checked out promptly.
Yes. And we need to be clear about what kind of changes. It's not just about finding a classic hard lump.
Right. What else should people be aware of?
Think about any deviation from your normal.
Yeah.
It could be dimpling or puckering of the skin. We call it retraction.
Yeah.
Or persistent swelling, redness, or warmth in one area.
Okay.
Even changes in the nipple, like inversion, if it wasn't always inverted, or especially any spontaneous bloody discharge from the nipple. Any of those warrants immediate professional evaluation.
So BSA empowers you to be that first line of defense by knowing your body and acting on changes.
Absolutely.
So wrapping this up, it seems the most effective strategy for early detection is really about integration. It's combining that personal, empowered vigilance of BSA.
With the objective, proven accuracy of professional screening tools like mammography and clinical breast exams. You need both working together.
It really is fascinating, isn't it, how a commitment to solid evidence, to science, led to retiring a public health practice that was taught for decades.
It truly is. And maybe a final thought to leave people with. BSA, this awareness, it's powerful, but its effectiveness hinges entirely on one thing.
What's that?
Your commitment to acting on what you find. Seeking prompt professional assessment if you notice a change. That personal alert system only works if the alarm bell is actually rung, if the change is reported without delay.